See, this is a 9-year-old kid for tonsil adenoid, which we have already done, and we've got a grossly deviated septum. And we have taken consent from the parents because we did this CBCT and we knew that there is a grossly deviated septum. So we can see this spur on the right side. We can see this deviation on the right upper septum as well. Now, question is, should we only remove this spur? Should we also do a proper septoplasty in a 9-year-old kid growing nose? So I'll start off with a spur. I have already taken my incision on the left side and elevated the plane. I'll just show you. Can you see this is the bone, maxillary crest, which is deviated on the right. I could have taken the flap uh, on the right side itself. That is also possible, but I want to not damage the flap. So I have lifted it on the left side only because my flap is completely intact on the left. Now what I'm going to do now is to dislocate this cartilage from the bone. I'm only dislocating the cartilage from the bone. A 9-year-old kid, I do not want to lose too much of cartilage. I want to preserve this cartilage and I still want to open up the airway. Alright, so this I have only dislocated. Now I'll use piezoelectric. I'll use piezoelectric to dissolve the maxillary crest. Suction please. You see, that's the bone. This is the cartilage. I'm only dissolving the bone. Straight forceps, please. Straight forceps. All right. Piezo. Sonopet. See, I still have a lot of bone here. All right. There's no loss of cartilage. I'm only dissolving the bone. Which is causing the block as a spur. Because it's a very thick bone, so it's taking a little time. As you can see, now I've taken my bony incisions very well. Suction please. All right. All right. I have got the left side of the flap is absolutely normal. So there is absolutely no risk of septal perforation. Very, very gently I am removing that bone. Can you feel? Suction please. This is all dissolved bone. Piezo please. Alright, now let me see what else is pending. This one is okay. I still have some bony attachment over here, right? This cartilage is still curved. It has not become straight as of now because I have not removed the attachment. Give me a straight forceps. Alright, suction please. Now let's see what else is pending. Do you have the microdebrider ready? Microdebrider please. Alright. Now give me the piezo again. See this attachment, this cartilage is curved. The attachment is here. Unless I remove this small bit of cartilage, I'll never get into the perfect plane. Give me a knife please. I'm only removing, only dislocating this. Alright, that's the bone. Suction. See, the bone is starting here. So unless I get rid of this bone, my cartilage will not become straight. Give me the piezo now. What I'm doing now, and again I'm using the piezo to dissolve the bone. Can you see this? Alright, suction please. Suction is not working, just clean it. Let me remove these bone chips. Suction please. Another suction. No worries. I'm just dissolving this bone a little more. Alright. This whole maxillary crest is dissolved now. Suction please. Alright. Now let's have a look. There's hardly any bone. We'll have a look at what is the status of our airway. I need some good suction. Suction please. Alright. There's still a little bit of bone here. I'll take care of this bone. This is right at the back. Obviously, this has nothing to do with the shape of the nose. Give me a lux, please. This I can just take a lux and remove so that we do not waste anesthesia time. All right. All right. Suction, please. Now let's see what's the situation. Is there anything else? No, it looks all right. All right. Maybe a millimeter or two more here. All right, this part. So let me put my, which is the part, this one. Lux, please. That's the rostrum of the sphenoid. All right. Now let me have a look once again. Leave it. You can see the septum is very much, flap is preserved. Septum is almost straight. Maybe a millimeter or two more can be done. We'll have a look. Give me a patty, please. So after, there is no damage to the cartilage so far, correct? Let's see how much improvement has happened. This nasal valve is compromised. I want to take care of this. The child is only 9 years old, therefore I am being conservative. Now see, the can I have the periosteum elevator? We still have this part is completely taken care of. This part is also completely. See, there's no cartilage, there's no bone which is actually obstructing. All right. So the mucosa is completely preserved till the end. All right. Now, if we want, we can remove or score a small part of the cartilage here. We'll just decide on no standard suction. Septoplasty suction system and hold the flap. So you can see the attachment of the cartilage is still there. None of the cartilage is actually sacrificed. But I will now sacrifice a very small bit of cartilage. Can you hold this flap, sister? Knife, please. Which is actually, I'll just show you the part which is actually deviated to the right. Only that small strip, very small strip, I am sacrificing so that there is no problem with the development, there is no problem with the shape of the nose, and at the same time, there is no obstruction as well. And we'll see what happens once we do that. Very small part of the cartilage is being sacrificed. You can leave it there as well, but there's no point. You're not going to participate in any manner. All right. Now let's have a look at the airway. That's the flap from inside. Small. Give me a lux, please. So you understand that that part is never participating in the shape of the nose. Now the question of any shape change does not arise. Leave it. So I have not touched the upper part which is crooked. This is still a little bit of obstruction here, but the major part of the nose is already taken care of, and there is still a little bit of bone. I'm not very happy about that. So let me reach there and see exactly what part is this. Okay, can you see this? Piezo, please. And this is the rostrum of the sphenoid, the upper part. Only melting as much bone as is really needed. Let's please. And remove that, all those small pieces which are there. All right. I'm good. Leave it. Now let's see. All right. So airway is completely open now. You can see I have already performed adenoidectomy. Now there's a little bit of deviated septum here, but I would not like to remove this piece of cartilage because this is a 9-year-old child and I want him to grow as naturally as possible. Give me a patty. See this? So if you still want, you can go inside and remove a part of the cartilage from here. But you can see this cartilage is actually not bent. So, and now that the pressure is gone, this cartilage will become straight in due course of time by itself, right? So, I'm not inclined to actually remove this bit of cartilage, and septoplasty is over. I will perform turbinoplasty rather, right? To open up the airway even further if needed. Give me a knife, please. There's a small bit of cartilage looking out from here. I'll simply bury it inside. All right. So that's the airway. Thank you for watching.